and cool. Thanks for recording that. Yeah. So welcome everyone. We have a very straight plain agenda in today's meeting. We'll talk about US healthcare concepts overview, and we'll deep dive into some of the concepts as well. Why are we doing this right now, right? So we have got a lot of new folks joined in our organization, and our healthcare practice is ramping up as well. So we wanted to share our knowledge which we have acquired with working with customers in past couple of months, as well as like historical knowledge which I have as well. So I'll be able to share this knowledge with you guys. Definitely it's going to be we will do this in multiple sessions. We are trying to do it now. The agenda would be to understand the basic fundamental concepts, because many people ask me plain questions like, hey, how does the healthcare system work in US? We need that tacit knowledge as well, right? So we'll start from there, and slowly we go to the different kinds of like concepts over there, and how things work over here, and some specialty care as well, like long-term care and hospice and palliative, which we are using in our projects. And most of the customers are all now moving their business to these domain areas. That's about this. And like a quick introduction myself, this is Maharaja. I'm working with Ideas2IT for like past 2 years as a project manager, and I come from a development background. I've also worked on different roles like project management, Scrum Master, and with this in my career journey, it's been like 14 plus years, and all these 14 plus years I've been working with US healthcare customers. So definitely I'll be able to share that additional information which I learned from other projects as well. On top of that, I also was working on onshore for the customer on hand in California for 3 years. So I'll be able to share more from that reality on the ground, since I was also one of the consumer of the right. I paid premiums, I got insurance, I went to hospital. So I'll be able to take questions or answer questions from that perspective as well. Definitely it's going to be a value add for people. That being said, with the no interest of time, thanks everyone for joining this post-lunch session. So we'll get things started. All right. So this is the main learning objectives, right? So as I laid out, so we are going to talk about basics of health insurance and coverages, demonstrate the complexity of healthcare cost, why healthcare is a like a regulated industry in users in industry in US, why every year new initiatives are being done by the government and states, who pays and who gets benefit and so on. Everything we are going to learn in deep, as well as like various healthcare products, plan types and so on. So if you see this, so you will be able to see
Zebronics for life.
so you can see, typically this picture says, multiple players involved in, like the US healthcare domain. You can see, the people in the streets, you can see people in the federal government who play bureaucracy and law, you can see the labs, you can see big businesses who are selling insurance. You can see physicians, insurance, like people who are, having good income, less than income, courts, all these people come into the play into a picture. As anybody cannot just come and sell an insurance in market. Everything is completely regulated. You have to follow certain standards, security and US healthcare, there are only certain players approved by the federal government and the state government, right? When I say federal government, it is basically like a central government. So they passed amendments and law. So that's why if you would have heard, when Obama was there was a plan called Obamacare Act. When another president came in, things got changed actually. So things do win for a change, but the main core lying healthcare concept stays as it is. We have to understand certain things, right? Why we need health insurance, right? We can say, hey, I'm from India, so we don't have health insurance, but whenever there's a hospital visit, I go to a doctor, take treatments, make appointments, take the treatment, whatever the fee, I just pay and come out, right? So we should understand, so just trying to take a case from our Indian background and trying to compare what if we are in US without a health insurance, right? Take an example, a 28-year-old person is having, a severe abdominal pain, and he is admitted to a ED means emergency room discharge, and treated with antibiotics for 4 days, and he also underwent to a surgery. Let's take two cases. A patient A had a health insurance, patient B did not. So the patient B says, hey, I grew up with a family without health insurance, I'm stable, I'm hale and healthy, So I don't want to take over a policy. I'll go for a couple of weeks. So I will not go to emergency room, right? So what happens is, if the patient goes, suddenly falls down and breaks down and collapses, if patient A goes, he is covered by health insurance. The entire insurance takes care of that. The claim of $45,000 is a bill in this case for this patient complex scenario. He gets reimbursed everything by the insurance. Insurance will pay that everything. He's not paying anything, just a premium by keeping his policy active. Other case, patient B, he has to pay this $45,000, right? Think about $45,000. It could be a couple of years of savings, right? It might wipe out your entire savings. That much amount of immense health importance this health insurance plays in the one's personal life. That's how they have mandated the health insurance. So you cannot survive in health insurance without an health insurance in US, basically. That's how I would put it. Couple of terminologies you should understand, like like the cost, the charges, the reimbursement, and price, right? So cost is actually the dollar amount we pay to deliver the healthcare service, basically, right? Premium is actually the cost, right? We pay, it could be $100 or $1,000, and every annual we have to pay in order to keep our policy active. Charges is actually the financial amount a healthcare provider asking for after getting the treatment. The charges or the bill or they will be submitting a claim. That is actually often the claim or a charges is an interchanging term they are using. Reimbursement is actually like when they pay the money, right, to the payer, or like in olden days we had the member submitting a claim, they get paid. So reimbursement is like for the insurance companies, if you are active in the policy, they pay you the service which is provided. That is a reimbursement. Price is actually like some of the terminology we say out of pocket. It could be copay, co-insurance, or deductible. We will talk more about these concepts. So these are some of the concepts in terms of price. Actually, some of the high level concept, because we will be repeating these terminologies. If you see in the data, right, this is like a 2016 data. It shows like you can see people in US are covered by, these are the spans where people are covered, they are insured or uninsured. You can see uninsured population is 8%, and remaining all people are coming either like employee based plans, 46, Medicare plans, military. So somehow they are covered in some health insurance. People will have options to go and buy, or the government will cover them, or your employer will cover them. If three are not done, like you might be uninsured. That's about this. 8% of uninsured rate is actually, it's very high. This is like they are not saying, they're saying this is pure based on the documented people status. There are undocumented people as well. They might also have without, they might also be surviving in states without like health insurance. This is like a major overview, so that you can say different options are available for people to be covered under the health insurance, right? So majorly, we can break this down into three ways how you can get an health insurance in United States, right? Individual private. Okay, you say I'm running my business, or like I am good in rich and affluent, so I should be able to go and get a plan. Yes, it's like when I try to compare Indian markets, you can go to Star Health Insurance or any LIC or any insurance companies and say I need an insurance for myself, by my family. They will tell you these are the people, what is the age criteria, this is a silver plan, gold plan, whatever you choose, your premium for this, your copay, your deductible, they will tell you. So you pay that in amount, activate your plan. In case of any uncertainty happens, you go to the hospital, cashless treatment will be given to you, you get the benefit, right? So it's a private plan. Individuals can choose a plan. That plan is called private plan. That's the first way you can get an health insurance in US. The second way is actually most of us are aware about it, because even most of the Indian employers provide this plan. Even our employees also provide this plans. They will be tying up with one insurance company and you will be given a plan. The benefits of employee private engagement plan is you will not pay the entire premium in this case. The employee pays a part of your premium, or the employee pays your sponsors you for the premium. And when you cover your dependents as well, their plans there also will be cheaper. When you go and buy an individual plan versus employer private plan, it's always cheaper. And employee plans are like widely accepted because it is basically comes under a class called group insurance. So the term group insurance is They don't check your age criteria. They will be based on your industry you come from. You are from information technology. There will be group insurance stand. These people fall under this age criteria. You might be working in a nuclear plant. You might be working in a chemical lab, right? How much exposure you have to hazardous things, like your plans and everything will change. That's an example about how you will get coverage in employee thing. So that's the employee. The third is very, very important, and I would say critical part, core and crux of healthcare system, I would say, and majority as well, government plans, right? So government also in US, they also cover the people. There are two major plans we say in government, Medicare and Medicaid. We'll talk about more. So Medicare, when you say, it's about federal program. When the federal runs the program, it is called Medicare. It's for 65 and plus elderly people. And Medicaid is for like poor people or low income people. Medicare is sponsored by the federal government. Medicaid 60 to 70% is sponsored by federal government, 30-40% is by the state government, and state government administers Medicare program. So, and when we will deep dive about these concepts, we ought to know about like Medicare. There are different kinds of Medicare government programs, like there are different parts. They all know, they call it by Part A, Part B, Part D, and Medicare Advantage Plan and so on. This is basically, like they cover you. When you are covered by Medicare, everybody doesn't qualify for everything. There are certain conditions when the people will qualify. So I don't want to deep dive into that. We can always like learn from online, but we should know Medicare comprises of hospital services, which is Part A. Any treatments for hospitals, it will be covered under Medicare Part A. Physician services, outpatient services, durable medical equipment services, laboratory, ambulatory, all those things will be under Part B. Part D, many of us know, it's like RX or the prescription services, right? So there is also Medicare Part C, which is Medicare benefits to private insurers, where Medicare government will buy plans from the private insurance and give it to people. So for an example, Medicare, the state of in California, they can purchase, go to a plan called Anthem, and they can give Anthem plans to others, so that Anthem will treat these patients and all the claims will be paid by the government. So these are some of the terminologies we should know. Again, this is what we talked about in the previous slide. It's easy read through. I don't want to repeat it here. Medicaid is actually the federal program. We'll directly go to like the differentiation of what is Medicare and what is Medicaid. We should definitely, every one of us working in US healthcare domain should know. As I said, Medicare is a federal government program for paying certain hospital and medical expenses for 65 and plus elderly person qualifying under the plan. Medicare covers a small fraction of long-term care as well. So there are other sub criteria as well. People do qualify for Medicare, like that's mentioned, like, so you can have a long-term kidney failure, you do qualify for Medicare. There are certain conditions you qualify on top of 65 plus. Medicaid is a state and a federal program, right? As I said, 60%, 70% funded by federal, and like rest of the thing is funded by the state. So state administers the program, and majorly it is for low income population, like 19 years poorer population under the poverty line. That is what Medicaid covers. So some people are poor as well as they are 65 plus, right? So they will fall under both the conditions. So they will be covered under Medicare and Medicaid as well. They will be qualified for both. That's what they call dual plan. So people will be calling us a dual plan as well. You will be having. So whichever service you take, which plan covers you the first and highest coverage, they will go for that. Actually, they qualify for that. So this is about very, very high and comprehensive overview about Medicaid and Medicaid. Another thing I want to share is Medicare programs are called Medicare throughout all the states in the US. But however, Medicaid programs are called by different names. In California, it is called as Medical. In Iowa, they call Medi-IO. Like, so every state renames their Medicaid into different things. So that also we should be aware about it. And private insurance, like when you talk about private insurance, would like to give some names. People would have known the major US largest healthcare players. Definitely people would have known Anthem. People will know about Molina Healthcare. People will know about, United Health Group. These are some of the major private insurance groups available in the market. Employers, all companies do cover. They purchase plans from these companies like Anthem, Molina, or like United Health Group, and give it to their employees. That's about Medicaid and Medicare. And as I said, US healthcare industry is very highly regulated industry. When I say highly regulated, there has been a lot of fraudulent activities detected in the past. And all these Medicare and Medicaid programs, we should understand how these things get funded, right? So we should also understand, we also, when we start earning in any country, like most of the country, we pay tax to the government. In US also, people pay tax to the state and federal as well. They pay a tax called social security tax. So they pay every month, whatever they earn, they pay an amount of social security tax. It gets accumulated until the age of 65, and eventually after the age of 65, the government is going to repay that in terms of taking care of you. So when you become 35, when you become 65 plus, you will be covered under Medicaid. Everybody is given the medical insurance. It's not free, but it's like that is the reason, one of the reason why people pay prompt tax in United States. The tax paying rate is very high, because whatever dollar you are paying to the government, it's going to come back to you. So that's about Medicare and Medicaid as well. So the state has your tax money all these years, so they will be, until you are here alive, they will be taking care by providing a Medicaid or Medicaid service. That's how things get funded. We should also understand about couple of acts which we need to do. Like one is actually HIPAA, like Health Insurance and Portability Act. So it was HIPAA is actually like very, in terms of when you are working in any health insurance related program, we have PHI, which is personal health information. When you say personal health information, it is nothing but your health information. It could be your name, it could be your drug information, it could be your previous medication. Anyone who is working or access to the data, including the doctor, nurses, including the we as an IT team, no one should expose this data. When we expose this data outside, it is a breach, and like we have a high penalty, or it could be very high consequences of exposing this data outside. So that's why we always work in a restricted and secure environment. Or personal identify information, it could be PII, right? It could be your name, your age, your date of birth, your phone number, your credit card information. We do access to all those vital information of a patient. So we should never expose any of these records outside, or should not be exchanged in private forums. So that is majorly like a law is born by HIPAA. Everybody knows about HIPAA. Another act we should know is like Affordable Care Act, right? So when things get commercialized more, everything gets out of the control. So always, like the government puts a watch. They ensure everybody in the states, they like they get affordable, cheaper, and better access to care, so that like they can like take care of them. So they always, every year, like they will be passing some laws to keep an eye and check of regulations. If anything got any new kind of diseases got like changed. For example, COVID popped up. Initially plans were not supporting COVID. Now state governments have passed regulations to cover COVID as well. So now all the plans, policies, everything got updated so that they cover you for COVID treatments and admissions and so on. That's one best example. So Affordable Care Act is actually to decrease the number of uninsurance. They wanted to provide care for people. They wanted to ensure like everybody should have insurance in at least one term. So they, like it was passed in 2010, where they set the minimum Medicare income eligibility across US to 138%, and so that they brought down the poverty slab so that more people could be covered. So that this is one of the initiative which they took. So we should know about the Affordable Care Act, right? We are talking about uninsured population, right? So that 8%, if you see, how is this uninsured population, right? So adults without dependents. So you could be orphan, like low income families, less than 400% poverty level. You are struggling for your, like food each and every day. You are living in streets. So how can you afford for insurance, right? moderate income families, which is like they cannot qualify for Medicaid or Medicaid, right? All these people are undocumented people, illegal immigrants, right? These people will be the uninsurance population. But like these people also are come into the care because sometimes if they are into a dire situations, they call 911 and the ambulance comes and picks them, they puts them into emergency room and they give the treatment. Eventually they end up without an insurance, right? So these kind of things also the government or like the state has to bear. That's what they try to bring uninsurance population down and bring them into that. Another interesting fact is people are wondering why the technology advancements has been like going through, like the history of US healthcare goes very long, like, and like they have historical data, and they see like more and more we get modernized the health, more and more we get modernized, and we get like into the new era. We are getting a lot of people challenging to access to care. Some of the access to care are like mentioned here, like no unusual source of care, like people are not aware about the plans, people are not choosing a proper plans, and people don't know how to get an PCP appointments, right? These are some of the ways like people are access care. That's why many programs are now run ensuring like you stay in touch, you outreach frequently to your patient, so that who is a doctor you need to go, who is a primary physician, who is a specialty physician, where to pick up our medicines. All those educational things are also given. At the same time, people are also like enrolled into certain programs which people are not aware about it. So there are a lot of teams doing that outreach, and they enroll into the people and ensure like they get all the services to survive. So other example, right? So this is another example when we talk about access to care. Another example, which is like an woman of 62 years old is presented to emergency with a dense hemimpharis and abstria. The CT scan confirms that the large MCN implant and the labs prevent previously diagnosed. So pretty complex terms, like these are like we can find it out, but like the intent of this case, the case is like to understand how complex this patient is, like how complex this patient was, and like how possessing an health insurance, having a proper access to care has changed and touched on this person, right? So because of how did the lack of health insurance contribute to this outcome? The patient has like developed these many complications because last 10 years the patient has not even visited a doctor, right? So she doesn't know what kind of complication she is going on. When she is presented to a doctor, they found out these many. And that's what health insurance says: when you have access to care, when you have access to hospitalization, you are likely to get these many amount of complexity. All problems will be documented, and you will be getting proper treatment as and when, and you will be not be into these kind of and eventually mortality rate goes high because of these kind of people. So they will be, that's what they call certain approaches called care management and utilization management. They ensure like you have proper scanning, you take flu vaccines every year, immunization vaccines every year. You have, are you having, like they will be examining you every year. Every visit you can do on, even though you're not booking appointments, the doctor's office will call you and they will book appointments and take you there. So that's what having an health insurance makes a difference, like just trying to show the case, because like how benefit these kind of tedious complexities could be avoided if we have a regular access to care and health insurance. We talked about out of pocket cost, right? So we should understand, we talked about premiums, right? Everybody knows what is a premium, right? You have to pay a premium to get an health insurance. So this is how things work, right? Take a patient X who's paying a premium of $1,000 with like deductible co-insurance and copay. So I will explain you what is deductible co-insurance and copay. There is a $100 deductible, there is a 5% copay, or there's another plan with $100 deductible and $5 like copay and 5% co-insurance. What happens here is you have to pay. People who have used insurance in India also will know the concept of deductible. It's not something new, right? In order to activate a policy, you need to pay the first deductible in the plan year to activate your policy. You go to a doctor, and the doctor says, hey, I'm treating you today, and like your total bill will be $500. So you have to pay your deductible at the doctor's office, which is $100, and also your plan says 5% of your entire bill, right? When you say bill, it's a claim, right? So 5% of it, like it comes around $25. So $125 you pay, and rest of the $375 will be covered by your insurance. So the provider will write a claim, send it to an insurance company. Insurance company will like pay this to you. That's how the system works. Another case is you are actually having an $100 deductible and $5 deductible, $5 copay. In this case, you have to pay $100 deductible and $105 you pay, and remaining $395 the insurance company will pay. There are some people will say, hey, I'm hale and healthy. I will never go to hospital. I'm just having a insurance to be regulatory. Because people have to have regulatory, you cannot opt out of insurance. Because if you're not having insurance, when you pay taxes every year to the government, they put you a penalty. Almost, if I'm not wrong, $625 will be put penalty. So people will have insurance at least to save that $625 penalty. So they will say, I'm just hale and healthy. I'm not going to hospital. I'm just using this in the past of having been compliant in the system. So for those people, they will choose a low premium plan with higher deductible. So which means $1,000 deductible, and the premium would be like $500, something like that. So which means you will never go to hospital. If you go to hospital, you are bound to pay a higher deductible, right? So when the premium goes down, deductible goes high. When the deductible goes down, premium goes high. So both are, like that's how the plans are designed by these people. So out of pocket expense, on top of paying the premium, you also bound to pay copay, co-insurance, and deductible. These are three out of pocket expenses people will pay. So a typical example, right? So charges of claim of $425, out of pocket is 25, out of pocket high deductible is 424. Medicare has paid 3,340. In this case, high deductible, you have to pay $1,528, and your deductible is 122, right? So you can see a difference how this out of pay. You can choose plans based on your need. That's the end of the thing. Uh, Talk about healthcare reimbursement. Right? We talked about a patient holding an insurance, going to doctor's office, provider getting a pain, right? So there is the government will be always designing in such a way that regulations in such a way that the healthcare costs are not like rising. So there are certain ways they pay. Insurance companies pay. They come to a contract with the providers, and they say, hey, I will send in my employees, there are 1,000 employees, I will send all of my 1,000 employees to you. You just treat them. For every patient, if one patient comes to your hospital, I will pay you $10. So that is called like per diem. Hospital is paid for all delivered patient during one day. So for every day you pay that. Or they can say, hey, I will pay you $10,000. You take care of my patients all throughout the month. Patient comes in, a patient doesn't come, doesn't mean. So that is kind of an engagement. It's called capitation. Fee for service is like physician is paid for every patient is like paid actually, like so. Or they could also be paid based on the diagnosis codes they treat, actually ICD-10 diagnosis code. So these are some of the arrangements and negotiations which the hospital providers and the insurance plan and the government comes into, and handshake happens so that you do this kind of a treatment, so that you are not sitting idle by not doing business. I will send you my patients to you so that you get benefit. At the same time, you give me a good care of my patients with a better and cheaper cost. So these are some of the engagements. So you will frequently hear capitation, fee for service, per diem, like diagnosis related. These are some of the terminologies we will come across. Engagement of how the claims are being paid back to the providers who have given the service. Uh, so we will like deep dive into some of the very important terminologies. Mandatory, I would say, core and crux of healthcare. We should know who is a provider. We'll talk about providers, we'll talk about payers, we'll talk about purchases, we'll talk about members, right? Very, very integral, basic foundation blocks of healthcare system. So when we say there are a lot of different kinds of evolution in healthcare has happened, like, so we have managed care, we have HMO, health maintenance organizations, we have PPO, we have POS. These are some of the different kinds of plan types. So you can go and take a commercial plan or a government plan, or you can be covered by any services. Under that, these number of plans are available. So you can choose a managed care, you can choose a POS or PPO based on your need actually. So let's little bit talk about those as well very quickly, right? So managed care or traditional indemnity. So traditional indemnity are the plans referred as fee for service plans. In traditional indemnity, the insurance companies offer to the insurance consumers before the prevalence of PPO. So what happens is, like, they will be the insurance companies will be paying for every patient whatever it is paying. And in olden days, before the providers were paying, how managed care plans operated was, the insurance companies will sell the insurance, the patients will buy the insurance, patient goes to the doctor provides the service, and the patient will file a claim and get the money reimbursed by the insurer. That is how it was. And later they found out there have been a lot of fraudulent activities done by the patient, where patient was making money out of the disease by filing multiple claims. So they removed that uh, patients filing a claim, and now providers are filing a claim. Eventually, providers are also doing, some cases are being reported, providers are also doing some fraudulent activities, but checks are in place. So that is about traditional indemnity. So you are paying for everything what like. So complete coverage, you can go to any provider you can want. There is no PCP concept. Main concept of managed care is you can go to any provider, any distance you can go. The plan will cover you everything, but no discounts will be provider, because these people will be out of their network. And insurer or the purchaser is at risk, because the insurer might not like get the better service, better tracking, and a lot of things will be there. And cost varies by level of out-of-pocket payments. So you might be ending up paying a very high deductible, very high co-insurance, very high co-pay when you choose these kinds of plans. But the only advantage is you will not be restricted by any means, like you should only go to this doctor and this particular doctor. No, you can go to any doctor with this plan, but expense will be high for you. That's about managed care. Then next evolution happened was HMO. After people thought something we should do for managed care, the next evolution of managed care was HMO, health maintenance organizations. So here what they do is they like bring down the cost, where care coordinated to primary care physician. They call this as primary care physician or PCP. So every person enrolled in a HMO plan will have one doctor, which is called PCP. Anything happens to you, you should first go to the doctor. The doctor will screen you, doctor will treat you. If you have a major chronic condition or a heart problem or anything, for example, then the doctor will refer you to the specialist. So you cannot go anywhere you want. You have to go to the PCP, and the PCP will refer you to specialist. You have to go to the specialist. So this way, like unnecessary spending, unnecessary cost expenses are reduced, and the limited access to, so only disadvantage is you have limited access to providers, because you have to go only in the in-network. Low member out-of-pockets cost, this is a very, very big advantage. Low deductible, high cost sharing, low copay, low insurance. So very, very advantage. People prefer to use this HMO plan, and it's widely accepted and widely recognized plan. Then people thought about, hey, what could we do more than HMO? We have better. So can we do a better plan? So that's where the next plan comes in, PPO. So which is preferred product organization. Similar to indemnity program, like it's a combination or a hybrid plan, I would say. Two levels of benefits. You will get first plan and the second plan. Combination of first and second plans is what this third plan is all about. So we have to break it into two levels, network and out of network. When you go inside the network, it works in the way that HMO, so the second plan works. If you go out of the network, it works in the first plan, how the HMO managed care works. You will pay when you go out of the network. When you say out of the network, if insurance might not be contracted with that provider. You might go to a different provider because there are some genuine conditions where the providers in the network are not treating you, or not, you're not comfortable with those doctors, or your doctor referred was in out of network. You go to that. When you go to out of network, you will pay high deductible, high co-insurance, and your claim processing rate will be 80%, 90% only will be reimbursed. When you go inside network, same like HMO, everything will be covered. You have to go to PCP. PCP will refer to specialty. So it's a hybrid of managed care plan and HMO. That's called preferred provider organization. Then the thing is, like hybrid of HMO and PPO. It's like a hybrid product, like, so enrolled PCPs, enroll is select a PCP who will manage in all in-network utilization in HMO more than the non-network product. So it is like combination of both. You will be having an option to choose an HMO. You will be having an option to choose a primary care physician as well, and also you can go out of the network. So that's what it is, hybrid of HMO and PPO. So this is also one of the widely people accepted plans, but eventually the disadvantage of these specialty plans are you might end up paying high premiums for this. There are people who say, I'm frequently going to hospital. For those people, definitely these plans will be a suitable need. Some comparison, like, so it's I will be sharing this with you guys as well. So indemnity, HMO, PPO, POS, right? Major thing is PCP not required. So only in point of service PCP is required. Detectable, it is required, not required in HMO, right? Because like you are inside the network, zero detectable. PPO, we have in network and out of network. Same concept of POS as well. So when you go inside network, deductible is applicable. When you go, when you go in network, deductible is not applicable. When you go out of network, it is applicable. Out of coverage, right? So out of coverage, HMO, they will not cover you, but other plans will cover you in out of, because in traditional indemnity, you can go anywhere. Referral for specialist visits in HMO, it is required. Other plans, it is not required. So based on cost, based on freedom, right? You can choose a plan. If you are ready to pay higher premiums, if you want to go to any doctor, you can choose this plan. So basically, these are some of the parameters. When you go to selection of an insurance plan, you will be considering these parameters to buy your insurance plan. Let me know I'm going fast, just trying to cover things as well. Just a quick time check, right? So that we can finish things, and we can also have ample time to have a Q&A. So we'll have next half an hour talk about, like some advanced concepts, and, like some of the concepts which we are using in our projects as well. And more of the organizations are evolving in this space right now because it's highly concentrated, and like the governments are also pushing these kinds of plans. At the same time, people are also like opting for these kinds of plans rather than going to hospitals and so on. So we will understand about we now know how the importance of health insurance. We know who are the players of health insurance, payers, providers, subscribers. We talked about that, how one health insurance service has been provided and rendered and opted, right? We know about that. Now let's talk about the healthcare facilities. Where are the places? We know it's not easy to say like all providers are in like provide healthcare. We need to understand what are the different kinds of like engagement available. So hospitals, we know what is hospital. We have gone to hospitals, right? Clinics, what is a clinic? It's a small place owned by the provider, and he will be taking care of the service. Psychiatric facilities, chiropractic is where they give you, like a physiotherapy. They'll be giving you long-term care, homes for ages, rehabilitation facility, skilled nursing facility. So there are a lot of different facilities, specialist services, like you will be having in US, and people who need will be, like referred by people, by the specialist to these PCPs will be referring them to this specialist actually. We'll talk about this in detail in the next 20-30 minutes actually. Hospital visits, right? So we know provider care for individuals for all ages and broad ranges of health problems, right? So it could be diagnostic, it could be therapeutic, right? Medical, surgery, emergency. Emergency, like any kind of something happens, an accident or anything happens, you collapse, like they take you to the ambulance and they put you in the emergency room and they take care. From there, you might be taken to a specialty cares. Surgical, any surgeries which we do. Medical treatments, ongoing medical treatment. Therapeutic, right, are all the pharmacy related. Diagnostic, they are trying to test you, the labs, whatever information in terms of diagnostic will be under diagnosis. So same, people are, we know about hospitals, right? So same, in these are the services provided in the hospital environment. In the hospital also, like the care is of different categories, like we should understand that, because some plans to support some of the products and customers we work for, and like their products are focused on these kinds of environment, and some product doesn't focus on that. So major three types are acute care, chronic condition, terminal, and palliative services. So when you say acute, like, so it's like short term, would say short term care. So when you had a particular injury or something, after that you want to go to a hospital, you fell down, for example, you played soccer and you fell down, you got injured, you want to have multiple visits to the doctor to get that wound care cleared. So that is an example for an acute, sorry, multiple visits, shorter visits. When you say chronic, it is a mentioned as long term. What does this chronic is? It is a lifelong illness, is what I would say. Like some of the examples of chronic is high blood pressure, diabetes, CAG, angio, like vascular disease in heart, right? These are some of the things cannot be treated in one or two appointments, right? This is an ongoing, it needs years and years or months and months of continuous, like appointment visits and so on. So these are long-term care, is called chronic visits. Terminal or palliative care is like end of life services. We will talk more about this. What is terminal, what is palliative, what is hospice care, what is home care, all those things we'll be talking about. So we should understand, like what is palliative, we'll see more in detail here. So as I said, acute is a level of health care in which a patient is treated for a brief but a severe episode of illness. When you say episode of illness or episode of care, this is a terminology which we will be frequently hearing in our business, which is episode of care. What is an episode of care is, say suppose, same example, you fell down, you make an appointment to the doctor, you get admitted. After the admission is done, they treat you. After the admission is done, they discharge you. So all the treatments which is given, starting from taking an x-ray, scanning you, all the blood tests, all the it could be a diagnosis, scanning, all the medications, surgery, until you get discharged, all the pharmacy medications are given, starting from admission to discharge. One admission to one discharge is called episode. That's called episode of care. So shorter episode of cares will be for acute, for conditions that are result of distress or trauma and during recovery from a surgery. Some examples of acute care. They will say post-acute care sometimes. Post-acute care means after you discharge from the hospital, there are some kind of activities like physiotherapy or chiropractic, right? Those kind of things also is needed. So those kind of services will come under post-acute care. Chronic condition management, right? We talked about this in the previous slide, chronic condition. So encompass the oversight and education activities conducted by health professionals, basically like high blood pressure, heart, multiple sclerosis, sleep apnea, like diabetes. These are some of the examples for chronic care management. And there are certain things, like the providers are like based on the patient's condition, there is something called quality gaps and HCC gaps. Some of our teams does use it. They will be able to connect the dots. So if the patient is having a diabetic, a chronic gap will be open. So HCPCS and HCPS, we have to, every time we need to, the provider will be addressing those gaps. They will try to close the gap for that they get paid. And the same time, quality gaps, every year they need to take an annual flu vaccine. All those kinds of gaps will be open, and as a part of care management, these kinds of gaps are addressed continuously every year, so that like the patients are put in proper monitoring and control, so that they don't develop this into critical. So chronic care management basically. Palliative care is like something most of us are started hearing nowadays. Is becoming so famous. And what is this palliative care, right? So it's a specialized medical care for people living with serious illness, like could be cancer or could be heart failure, right? So kind of end of life care, right? But patients in palliative care, palliative facilities are specialized facilities, not the bigger hospitals, where they may receive medical care for the symptoms or palliative care along with treatments intended to cure the series. So cancer, so they will be putting you into that palliative facility and you will go through rigorous treatments where they will take care of you. At the same time they will like try to cure you as well. Palliative care is meant to enhance a person's current care by focusing on quality of life, so on giving them life for them and their family. So they will ensure like all facilities are available in the palliative care. So acute we talked about, chronic we talked about, right? So sudden onset, you fell down, you got injured, right? Any acute therapy is a short-term medical. Chronic is actually a slow or gradual onset, like a diabetes, right? We talked about this in the previous slide in detail. Terminal or palliative, right? An illness from which the resident is not expected to recover and will die. So palliative means they will try to cure you, right? Cancer, heart failure, they will try to cure you. At the same time, terminal services means the end of palliative care where you are determined that you will no longer survive. You are definitely going to die. For that, also in US, they have some services like hospice and terminal care where they will put you into those facilities where they will be continuously monitoring you until you die, like giving proper medications, taking you. There are certain things people cannot take care as we take care at home. So they will be having all those, the nurses and people will be taking care until the person dies. So they will ensure like the person dies properly, like with a proper care. That's about hospice or terminal care. Long-term care facilities, right? This is another LTCA, like LTAC they call, like extended care facilities, skill care facilities, nursing homes, continuing retirement community enclosed. So these are small facilities where skilled care facilities, right? For example, they would like you to go and take, for example, skill care facilities could be, like they might be very specialized in treating older patients and diabetic care. So after the diabetes chronic management treatment is done, the doctor recommends to be put under the skilled nursing facility. And in skilled nursing facility, they will be put into all monitoring in place. Their diet will be in control, and they will ensure like the person resumes back normally. And after they get discharged from skilled nursing facility, they go to the home and they make all the normal appointment visits and so on. So they go for a shorter term and come back. Some people also like stay forever in these kind of facilities because of their health condition. So you can ask me how it is possible, because the health insurance policy covers that, plans to cover that, they are becoming eligible because of their condition. Another example for long-term care is extended care facilities. They will be giving you lot of support. It could be like they will help you to bath, because people will not be able to walk, people will not be able to like eat, people will not be able to groom. So they will be services to help you, like bathing, grooming, like toileting. All this help also is provided in these kinds of facilities. We do have services for those people, right? So most of the long-term care facilities serve elderly people, disabled or handicapped persons, people with chronic illness, right? So this is what I talked about. And it could be medical conditions, it could be nursing care, it could be nutritional, recreational, like people also, like sometimes they say, hey, I want my physical condition as well my mental being, because there is a statistics and a concept called behavioral health or mental health. Like it says like it's very bad to come up with this data, but like that is a reality. We have to accept it. 1 in 5 people in US are mentally retarded, which means they suffer from like anxiety, they suffer from behavioral health. So there are services, recreational services, smoking sessions, drug sessions, like to get rid of those kind of tensions and everything, like, so those things come under recreational. People want to go to church. Yes, the plan supports. They will be able to book an Uber. They will be able to take you to the church and go there. If you want to go to one of your friends or daughter's wedding, or like some of the family members wedding, you don't need have an option. So the plan supports them, so you can request that. They will come, they will take you, they will mention like you are getting ready, and like you are going to the wedding, like, so recreational services also provided. Rehabilitation, right? So continuous ongoing rehabilitation after a surgery or major issues, right? So rehabilitation, physical and mental, will be provided. So some of the deep dive classifications of long-term care facilities this is just a beginning. Honestly speaking, I cannot put everything under here, because way deep concepts are also available. But if we know this, we will be able to start this and work in the projects, and like we can explore more. Home care agency, right? So home care agencies are some of the facilities, so the provider care in the home. So nowadays home care is becoming so trending and being most populous, because people doesn't want to step out during pandemic time, right? People want to take care of home. That's why we talk about telehealth solution, video conferencing solutions, all those things come into picture. So nursing, physiotherapy, the doctor comes to your home, occupational therapy, speech therapy, social services, nutritional and dietary services, respiratory therapy, like if you need if you need a ventilator services, they will be providing you at home. So home care make a services. So a lot of services are being provided, wide range of services are being provided in home care services. I would like to recall one instant. Like there are certain programs in certain states where they call PCS and waiver services. Where like if the doctor discovers the potential risk of a patient getting admitted to a hospital, might be you might be falling, right? When you get older, you might not be able to stand, so you might fall down. If you fall down, the risk of injury is very high. So proactively they will address these people, and they will be giving you a handrail. So like if they are walking out of the house, they will check whether their footsteps are having the proper handrail. If not, there are special programs where they can order a handrail and they can install the handrail, so that the people doesn't fall. In your bathroom, if you're bathing, like if you can, there are potential chances you can fall. If you don't have a shower handle, there are certain provisions in the state and federal programs where they will be able to order that handrail, so that you can avoid the patient being fall. Eventually you are saving the patient being readmitted to the hospital. Eventually it is a cost saving. So a lot of initiatives are there, like to support people who need care in this program, wide variety of programs. A little bit about home health, right? So home health is basically you take the hospital in the home. So when you prefer a home health, the doctor carries the entire kit with him into the home. They come and visit you, they do lab tests, they help you with daily activities such as dressing, bathing, assistance with safety management tasks around the house. If you have any chores around the house, they'll be able to do it. If you want to go and pick up groceries, they'll be able to pick up you, arrange you for people to pick up groceries. Companionship, therapy and rehabilitation service, short or long-term nursing care for illness, disease, disability. All care will be provided in home health. So we should know it's basically bringing hospital to your home. That is a saying, right? The care you need in the place you love. That's what they say about home health. I've just highlighted here the care you need in the place you love. So that speaks volumes about home health. Hospice, right? We talked about hospice. It focuses on care, comfort and quality of life of a person with serious illness who's approaching the end of life. So he's about to die, so they will ensure like he dies properly with all facilities, like he's not like struggling. So he will be having, until he dies, they will be able to take care of him. Actually, that is about hospice care. Some again this is like home health care, cardiacs. These are some of the specialty services we should know about. What is workers compensation program? Chiropractic is basically like physiotherapy. That's what the other term of chiropractic. Rehabilitation services, Home healthcare. We talked about cardiac surgery, oncology, care for patients with chronic diseases, and diagnostic services, radiology, magnetic, X-rays, and so on. So some of the specialty services, even when they take you to an hospital through an ambulance, it's called ambulatory, or when they like the people are giving like anesthesia, everything is covered in the healthcare world, and everybody is who provides a health insurance is called a health insurance provider, and the people who serve you are called physicians. People who take are called patients or members, and if you have your family members added to it, subscribers or dependents. So these are some of the core terminologies which we keep hearing again and again in the healthcare world. I think that would say we'll conclude this, and I would like to like conclude this with an overview and some deeper insights as well. And we can have some enough questions and collaborate. I want this session to be a collaborative one as well, and we will try to have a collaborative session going forward. I'm done with the session. We'll move to Q&A. The forum is open for people so that we can close this with the interest of time and we can stick to the schedule.
Maharaja, thank you very much. I couldn't join because of a client meeting. I just joined towards a fag end, but it's good that the recording is there. Let me go through the recording and get back to you with any questions.
Sure, Kalpana, definitely. Just a oversight, we can have more deeper conversations around certain terminologies if the teams are interested.
Sure, thank you.
Questions, team?
Hi, Mara. Thanks for briefing us on this healthcare. So a quick question which comes to mind is like we said, hello?
Yeah, go ahead, Ashraf. I can hear you.
Yeah. Okay, thanks. So we said like, people are paying social security tax, right?
Yes.
And in return they are getting like health facilities after some age. So yeah, if is it mandatory like those only people who will pay social security tax only those will get like these benefits?
Anyone in very good question and a valid question. For an example, take you and me, right? We are earning legitimately. You pay tax to the government of India, right? You pay a government to like you pay a professional tax. Also, you pay an income tax as well, right? So all the income tax, is there a way you can escape income tax? No, you cannot, right? Being a employer of a company or employer, like you cannot do that, right? So you are obliged to pay because your company takes the tax and puts it into the government every month on month. Same concept when you work for any employer, state or federal programs, you will be under, there is something called same like our PAN ID. In US, they call it a social security number, SSN. So you have to have an SSN to like to get employment. Without SSN, nobody will give you a job, and SSN will give you your entire history. It will tell you when you came to US, when you paid your first, when you got your first credit card, where whatever expense you did, what are the plans you had in your past, like what are the every year your income, how much month you pay tax to state, how much tax you pay to the federal government. They will give you all history, so everything is tracked in your SSN. So there is no way you can escape. I'm talking about legitimate. Yeah, there are ways people to earn cash under the table. Let's not talk about that conversations. When you are legitimately making money in US, either you are an employee or an employee or an entrepreneur, you are bound to pay tax. When you pay tax, the tax will be split into three buckets: federal tax, state tax, and SSN tax, social security tax. Everybody is bound to pay all these three taxes. There are certain, since you brought this concept, there are certain government, so there are certain states where the tax is nil. For example, the states of California and New York are collecting very high tax, but whereas the states of like Iowa and Texas, the taxes are very nil or negligible. So if you are residing in those states, you will not pay the state tax. However, you will pay the federal tax and the SSN tax. You have to pay. So you have to pay. Every dollar you pay, they will be coming back to you in terms of like they will be giving you Medicare or Medicaid programs.
Okay. So yeah, so if any person is not able to pay any tax throughout his life, so will he not be eligible for that Medicare?
Nope, he's not eligible.
Okay.
He's not eligible.
Okay. Yeah, got it.
Social security tax, because paying there is a class, like if I'm not wrong, there is a class like 65 years on age and last 10 years at least you should have paid tax. There is a class, so you should have paid a social security tax, not throughout the entire period, but some point of time you should have paid, like you should have paid. I can double check that class and give it to you, but you have to be paid tax, social security tax to become eligible.
Okay, yeah, got it. Thanks, Maharaj.
Okay.
Hey, good afternoon, Maharaj.
Yeah, Prashant.
Yeah, thank you for the useful session. I had one question regarding that, regarding the fee for service that you mentioned, right? So
Correct.
recently I went through some of the articles which mentioned that, the industry trend moving towards from fee for service,
Yes.
to the value-based service.
Value-based service, yes.
So, it would be useful for me if you can give some explanation or throw some light towards that value-based healthcare concept.
No, definitely, right. So fee for service or traditional indemnity, right? So as I told you historically, a great question again, like thanks for that. So we need to know the history as well. Traditional indemnity or fee for service, olden ways of paying a plan is, the name itself says like fee for service. Every service you provide, you pay a fee for the provider, right? Every visit you make or every specialty appointment you make, you pay for that provider visit. The product charges you for that. And there are olden days where the payer will, the member will be filing a claim, the member gets reimbursement. Now the providers are filing a claim, and like you are covered by a plan, fee for service members. What is value-based care is actually, like it is a plan where it is a comprehensive wraparound service. For example, you are having a health insurance, but the value-based care, like they will be providing is, they will be doing risk stratification. When I say risk stratification, you have a chronic condition, diabetic chronic condition, or you have, like heart failure. These kind of issues are there, right? We talked about chronic condition management. Your plan will cover the value-based care. It will provide you value as well, treatments as well. So every year your health checkups will be done. If you are a woman, like there is some process called collateral screening, breast cancer screening, all those proactive things will be done. COVID tests are being done in the current world, and whether they will be doing echo tests and CAG. So there is a lot of modern algorithms where if you have a particular, if you're taking any particular medications or particular treatments, the system will tell you might get, in 5 to 10 years, you might get diabetic. So they will start those kind of diabetic. You might become obese, right? All those, your information, like it's fed in the system, and it will be telling you proactive future predictions, predictive things, and they will be giving you care for that. Your programs will be caring for that. Not just if you have a problem, you just go and take the treatment, right? That is fee for service. You go for a certain problem and come out. Value-based care is not only the treatment which you are currently doing now, it is a complete wraparound service, utilization management, care management, it also like geriatric predictive management, GPS they call. Geriatric is like senior care population, people having smoking sessions, wellness sessions, right? All these services is coming under value-based care services.
Got it. Yeah. That helps.
Yeah. And people, the providers who are treating value-based care, they get paid more, honestly. So more companies are focusing on VBC. Yeah.
Yeah, they also have that performance-based kind of like.
Absolutely. Targets and performance, and the providers also have metrics and dashboards and everything comes into picture. Yep.
Got it. Thanks.
Thank you. Any additional questions, team?
Maharaja, one more quick question. Actually,
please.
Yeah. Actually, Maharaja, where does like home health comes into picture? Like, is there any criteria that the insurance company will provide you only the home health if you fall like under some criteria, or is?
Yeah, no, definitely, right. So definitely when you want to talk about home health, we should, like it's definitely a deeper topic. I would say people to qualify for home health into multiple conditions, Ashraf, like I'll show you, I have some of the vendor portal, like you will be able to see that. Let me see if I can share that here. If I have it open, give me a second. So people prefer, right? People prefer to take home health because, like people don't want to go to hospital, and, like people do qualify for home health, or there are certain plans. Home health services are being, like projected and a unique selling point. How the home health is getting paid, if you see, private insurance companies, like sell you, they will tell you like your plan includes home health care. And, like you can also say, you can also privately pay. If some of the home health, like there is something called self pay or self funded, you can also pay an additional fee to get the home health services. Some of the ways you get home health paid. People qualify for home health, right? When you say you need a therapy, continuous therapy. You cannot, these are continuous therapy and rehabilitation services. You don't need to go to a hospital. You don't need to get into a hospital, or you need to wait, don't need to wait into a hospital or provider to get this treatment, right? For a rehabilitation therapy, or, like your speech therapy, right? These could be done at your home as well. So these are some of the conditions where people do qualify for home health. And it could be like short or long-term nursing care. They want you to put you in a proper diet plan. You don't need to go to a hospital to get the diet plan and doctor to feed you in the hospital, right? The nutrition can come to your home, and they will be taking care of you. So these are some of the conditions where you qualify for home health, and the provider and the plan also only covers you under that.
Okay. Yeah. Okay, got it, Maharaja. But one thing, like when we talk about Medicare, that is something which is provided by the government, and in that case, we do not choose, like, it can be like whatever government has fixed it. It has
Correct.
to be like that.
No, government also, like again in Medicare and Medicaid as well, there are certain conditions where you qualify for home health. See, home health is nothing but it is a care which is given in your home doorstep. Okay, you are not able to go. You might be, like disabled. You might be, like not able to walk. Right? There are certain conditions where they will come, and home health is not something new, Ashraf. We have to be very, very practical. You would have heard a concept called field team care. Field team care is nothing but, like doctor goes to the patient's home and checks on appointments, and, like they will be providing care. Field team care is something, like a modern day terminology, which is called home health care. So this is something not new. We have been doing, like you would have remembered in the olden days, some kind of an emergency or something happens to our someone close to our us, like you can call the doctor will have come to your home and taken the have a visit, and he would have recommended take him here, take him there. That is called home health, basically.
Okay, yeah, got it. Actually, I remember one of the things which our customer was telling us the other day, like we have to qualify some score in order to get that, like,
Exactly. That's what, right? So when you say value-based care, which Prashant was talking about, is one of the value-based care is also home health. Like you have to, they will be doing assessments. They will be asking you a question like whether you have a potential fall assessment. It's called another example. Right? Let's take an example: fall assessments. What is a fall assessment means? They will be asking you set of questions to analyze whether you will be able to you have fallen in the past, or you are risk of falling. They will say you, hey, have you had any issues in after sitting for a while? Have you had any issue in standing up? Have you have any issues in walking up? Right? Every question will have a pointer, and every pointer will add it to the score, and it will generate a score. That is where you qualify for these services. So it's not just like that given. Everything they documented, they do assessments for you, and based on that only you will be having all the services. You are going, there is another algorithm called ER frequent flyer. That's called emergency admission. So if you are going frequently to an emergency room more than 3 times in last 6 months, they put you into one flag and they will monitor you. If you are again going, they will see your utilization. So all these things are like care management and utilization management concepts, which they will be continuously monitoring you.
Okay, got it. Yes, Maharaja. Thanks for bearing my. Sometimes my questions might be illogical, but thanks. Yeah.
Oh, yes, yeah.
Thanks.
Any other questions, team?
Hi, Maharaja.
Yeah, Madhi.
Can I talk about demographics? What is the terminology?
Got it. So yeah, demographics is basically, like when you talk about demographics of a patient or a demographics of a provider, right? It is actually the name, the age, the date of birth, the sex, the location, address. Basically, this is what a combination of is demographics. So, patient's name, patient's age, patient's sex, patient's, like uh, the patient's address, street where he lives, house address, right? That is what about the patient's demographics. When you say talk about provider demographics, eventually the provider name, his tax ID number, his like where he is, whether he's a rendering provider, he's a clinician or he's a physician, right? All this information, his address. So basically, address and name, how you identify a patient, that is, or a patient or a provider, is called demographics.
Okay. Can you tell me about that vendors, how it will be useful in the real-time health insurance? What is the use of the vendors terminologies?
What do you mean with vendors?
Yeah. So we will have vendor as provider and contract they will have between the providers and the patients, right? So,
got it. So it's not basically vendor, I would say. It's a contract between health insurance it's a contract between the payer and the provider, right? So a company like Star Health Insurance, for example, comes into the picture. They say, hey, you might develop serious illness in the future, but we want to cover you, right? They say, you pay me every year 15,000 rupees of premium to me, I will cover you for 3 lakhs. Something happens, you go to a hospital and take treatments, it will go and take the treatment from the hospital. Let's take a hospital ABC. If you are not having a treatment, technically that hospital would have charged you like 2.5 lakhs or 3.5 lakhs, anything in this range, right? So there are some hospitals who can cover you less. Some hospitals say you 3.5 lakhs also. Since you are in insurance, you are contracted, like what when you say vendor, the health insurance company, what they've done is, hey, I'm going to send you all of my patients to your hospitals. I'm going to add you into my network. So you will be getting business from me. So if you're doing a treatment for 3.5 lakhs for everywhere, when my patient comes in, you have to do it for 3 lakhs. That is a contract they have negotiated. So it's a discounted rate between the insurance and the provider, right? So you get benefit as well because you are a part of that network.
okay. Yeah. Thanks, Maharaj.
Thank you.
Hi, Maraja. Thanks for the information. And I have one question.
Please, Madi,
Yeah. So whether US government have the government hospitals? So if yes, is there any preference to go private hospitals with the government insurances?
No, this is another good question, right? So in US, they do have government hospitals like we do have, right? But if you think about this, right, everything cannot be done by government, so they have technically outsourced to the lot of market players, where these market players come in, they will be playing the part of, like physician, provider, health insurance plan. So that's what government plays a part, and government plays on top of everything. If you say in a particular zip code, there are 1 or 2 government hospitals, there'll be 10 to 15 private hospitals, same like as we have. But every insurance is covered in all the hospitals. They do have. So when the next part of the question to answer, should the government be sending you to those hospitals? No. Again, it's based on the insurance what you have, the plans what you have. We talked about different plans, right? Preferred network, all those things comes into the picture again. So it doesn't mean like it's a government hospital, you can go and take free treatments without an insurance. No, you have to have treatments, you have to have insurance for that as well. Only thing is, in the government hospital, the doctors will be paid by government, and the private hospital, it will be paid by the private companies. That's all. That's the difference. Same like here. But everybody has to have an insurance. You cannot go to a hospital like India. You cannot go to a hospital without an insurance. The first thing when you enter the hospital, they will be checking your ID card. So when you have this enrolled in a plan, you will have an ID card, right? I think we people also have that ID card should be active. If the ID card is not active, they are not going to give you service. So they will be checking that, Madi.
Yes, Maharaja. So in getting treatment in government hospital itself, we need the insurance.
Yes, everywhere.
Okay, if a person don't have insurance and went to the government hospital.
So there are certain situations. This is, I mean, this brings us to another conversation, right? A lot of people, what happens in the US is you have to again understand the reality in the ground. If something happens to you, people are homeless and people don't care, right? People have things. Everybody can call 911. It's like 104 and 108 in our country, right? So they have 911. When you call 911, like fire, ambulance, and a lot of services are there. When you say somebody's down, we need immediate attention, within a fraction of 2 minutes or 3 minutes, an ambulance will be in your home. Not only one ambulance, 2 to 3 ambulances will be in your home. And when one ambulance comes in, it will be having a doctor, fireman, and everybody, and they will come in and take care of you. And if they need to take you to the hospital, they will take you to the ED. If the first ambulance is taking care of you and leaving you, then only the other ambulances will leave that place itself. Okay, that much very, very responsive it is actually. So they will come and take you. In that emergency situation, they're not going to check you whether you have insurance or not. And they will take you to the ER facility immediately. They will give you the first aid. They will give you the lifeline services. After that, like they will give you the services. They will check you what kind of insurance plans and everything you have. Once you're stable or if you are with someone, they will do all this processing. There are situations where people are not having insurance. So uninsured people intentionally go to ER frequently. They don't go in a normal situation. They go to these kind of dire situations. And the law supports people. And when you go to ER, this is bared by the government. They will be putting under the plans, So these are some exceptional cases where you will get care without insurance, Mati.
Got it, Marja. Yeah, thanks.
Any additional questions, Tim?
Hey, Maharaja, I don't have any additional questions, but I just wanted to thank you for taking this session. This helped refresh a lot of the concepts that I think I thought I knew, and helped me rehash all those topics and helped me learn a few things that I was not aware of. So thanks for taking time to walk us through this and spending time on Q&A. Appreciate it a lot.
Sure, Vijay, definitely. Thank you. Team, any more questions?
Raja, Maharaja, one question.
Yeah, Nitya, please.
Just to make just a comparison. Okay, so with your with our healthcare studies, with concept of US, which healthcare which is more good, where India where we doesn't have, like, just for a comparison I'm asking.
No, definitely. If you want to compare apple to apple comparison with Indian healthcare and US government healthcare, we are not even, I would say, 10-15%, Nitya, I would say. So it's not about facilities we have, it's about access to care and the way we, like extend that care to everybody. In our governments also, we have plans, right? We have, like the state government plans. We have insurance for people with limited amount of people, right? Normally, people with, we also used to have ESC hospitals. You would have known, right? It's not something new actually, but we have to modernize those. We have to ensure like the care is given for people. If you think the next boom in the market are all about these insurance companies, people are going to go. If you see the population of health insurance, right, it is not even 5% or 10%. Let's become another practical point of conversation, right? If you compare both worlds in India, right, motor insurance, take an example for motor insurance, bike insurance or car insurance, it's become mandated, right? You cannot drive out a motorbike or a car without an insurance, right? You know that, right? You cannot without an insurance. Police will catch you, police will fine you, right? Some people are having insurance. Why we are having an insurance? Something happens, we are going to covered by the insurance. If we hit someone, they are going to be covered by the insurance, right? So the concept of insurance is to safeguard you in terms of dire situations, right? That is the concept of insurance. But how many people are taking insurance? We take insurance because police will catch you. That's why we are taking insurance. Right? That's a mindset we have, right? But in US, you have to have insurance. It's mandatory. No exceptions. Everybody should have motor insurance. Everybody should have health insurance. So it is mandated by the government itself, number one, right? So everybody have to have. Some people doesn't have, that's a different story, but people should have. Second thing is the plans cover everything, right? You pay premiums and it creates work streams. And like when you put people into these systems, right? If you see any particular disease or any conditions, if you take in US, they have systems documented it. There are systems like, like you can search another software which I was talking about. I was researching in a couple of weeks before, is called Health Gorilla. Okay. What this application does is they have integrated all of your hospitals, all of your labs in the entire US, 95%. So this Health Gorilla is actually having history. If Nitya is born in US and he's born in 1980, till 1980 to 2022, what are the hospital visits he has gone, when he has gone for admission, when he got discharged, what medication he took, what scan he took, what lab he took. They are able to see historical data. With historical analysis, a lot of information could be done. You can do better care management, predictive management. So what happens here is, most of the cases we are doing reactive care. Something happens, we go to hospital, trick, then we take an insurance. Now here you are actually having proactive. You do before, right? It's more proactive. That's why I would say we are more reactive, they are more proactive.
Yeah, got it, Rajat. Thank you because the question
Yeah,
a wide thing to research, but you have wrapped it in consolidate in a nice way. Thank you, Raj.
Yeah, the motor insurance and the health insurance concept, if you compare, you will get answers. We need to go a long way.
Yes. Yeah. Thank you, Raj.
Thank you. Any more questions, team? We just have 4 more minutes. I want to close this call because it's been 1.5 hours, but let me know, this doesn't end here, right? As I said, this is just the beginning, like definitely I'm also could have not known about certain concepts. You can hit me by a message or call me, like send me questions. I can also, if I know, I will be redirecting to you. If not, like I'll be getting that knowledge and giving to you or routing it to the proper channels as well. I would say this is just a beginning. If you want to have certain deep dive concepts, hey, I want to learn more about home health, I want to learn more about acuity, I want to learn about plan and products. My projects are using oncology, right? There could be some specialty services which you could be used in your applications and projects. If you want me to talk about that, hit me again. We will collate all those things and have a version 2 of this meeting as well pretty soon. We can have a continuous learning process. Good, team.
Any more questions, people? So anytime,
Yeah, I think you are done with the questions. Yeah, thanks.
So anytime, any questions you want to get it, you can get it from Maharaja anytime. So thank you so much, Maharaja. Such an informative session. Again, we would definitely have one more session on this. People come up with. Thanks once again.
Thank you, team. I know, do share the feedback as well. Definitely, feedback is the only way we have to improve, right? So you can say this was not able to understand. You can go slow or you can go fast. So whatever feedback it is, open for feedbacks. That's the way we have to scale up as well, right? So send your feedback as well, which is very important.
Thank you all. Thanks, Maharaja.
Thank you, team.
Thanks. Yeah.
Thank you all. Bye.